Aujeszkys disease, also known as pseudorabies. In swine, it is a febrile disease, and the general signs are respiratory and abortion. In other animals such as canine, ruminant, and equine, it causes lethal encephalitis. The occurrence of the disease is worldwide. It happens on large-scale pig farms, but the eradication is now happening, so the disease is less frequent. The etiology of the disease. So the alpha herpes virus has the varicella-virus genus, and this genus has swine herpes virus 1. It is antigenetically very similar to bovine alpha herpes virus 1, so it's related to bovine herpes virus 1. There's cross-reactions in the genera. The epidemiology of the disease. So it's a herpes virus, which means there's a latent infection, and it can be introduced by infected pigs or wild boar, and infected pigs can be a lifelong carrier. The disease can also be found in hunting dogs. The primary host is swine. It's a Aujeszkys virus. Other susceptible hosts include ruminant, equine, and carnivores. Carnivores are most susceptible after eating infected raw meat, especially in a slaughterhouse. The disease is shed in discharge and in semen, especially in the acute phase at 2 to 3 weeks. It has an age-dependent mortality, with younger piglets being badly affected and it being subclinical in adults. The maternal immunity lasts 2 to 3 months, and it can cause an intrauterine infection. The pathogenesis of the disease. In swine, it enters the body through an aerogenic infection. It can also be per os, or contact, or abortion, or semen. But when the aerogenic infection happens, the primary replication happens in the lymphoid tissue in the throat, or in the nasal and pharyngeal mucosa. It can also happen in the tonsils, and then a cell-bound viremia occurs. It then affects the lymphoid cells, and then a secondary replication happens in these target audience, the lungs, the fetus, the brain, and in piglets it has encephalitis. In other hosts, there's no viremia, there's no shedding of the virus, it's a dead-end host. It enters their bodies through an aerogenic infection, and from here it spreads along the nerves to the brain and causes encephalitis. In swine, the clinical signs are an age-dependent mortality. So the newborn piglets have a peracute sudden death with 100% mortality. They have encephalitis, tremors, paralysis. In gilts, we can see respiratory signs such as cough and nasal discharge, and also head shaking and abortion. The recovery usually takes 5 to 6 days. And we can see residual symptoms such as head trembling and ear tics. In adult pigs, we can see a subclinical infection or mild respiratory problems. And in pregnant animals, we see abortion and placentitis. The incubation period is 1 to 14 days. In non-swine hosts, the incubation period is 2 to 6 days. It's shorter and there's no viremia. In cattle, goats, and sheep, we can see opisthotonos, ataxia, and itching, and tremors and paralysis. Horses are less susceptible, and in dogs, we can see excitement, staggering, and paralysis. And in cats, we can see anisocoria and salivation and convulsions and itching. The pathology is it causes interstitial pneumonia and lung edema. In the fetus, it causes splenomegaly and necrotic foci. For the histopathology, we can see non-purulent encephalitis and intranuclear inclusion bodies. The differential diagnosis is rabies with the neurological signs and classical swine fever. For the diagnosis, it's a notifiable disease. The virus isolation is strong due to the CPE and the nasal discharge, etc. You can detect the agent with a PCR, IF, and ICH through a bite wound or a hunting dog. And you can detect the antibody through virus neutralization and ELISA. For prevention, follow the epidemiology rules. Close the herd, isolate animals of the same age group, and control wild boar and rodent numbers. And do not feed carnivore slaughterhouse meat or wild meat. And there's immunization of swine. There's not a reliable vaccine in non-swine host. There is an IgE negative marker vaccine, which means it's inactivated or attenuated. Piglets are vaccinated at 3 months and then 2 weeks after, and gilts are vaccinated 6 months after fertilization and at day 70 and 90 when they're pregnant. The virus needs to be controlled through eradication. It's an obligatory national law. The first one is herd replacement. It's simple, easy, but it's expensive. The next step is generation free. vaccinate the herd, and raise piglets isolated from the herd. So once the piglet is born, you isolate him, but you give him colostrum until day 3, and then you do a serological test. And then step 3 is selection. Vaccinate all pigs every 4 months. And then test with discriminative ELISA test. When the number of seropositive animals is low, then you remove them from the herd. And you repeat this every 6 months until the shedding and clinical signs have decreased. Maintenance and monitoring is important. You do regular ELISA monitoring, and you only use semen-negative boars. And do serological tests when there's abortion and stillbirths.